Welcome to BDI Briefs. This is another exciting installment where we take a brief look at important issues about the emotional side of diabetes. Thanks for joining us today. I'm here with Dr. Bill Polanski, president of the Behavioral Diabetes Institute, and Dr. Susan Guzman, director of clinical education at the Behavioral Diabetes Institute. Both are world-renowned diabetes psychologists who do so much for all of us living with and working in diabetes. My name is Scott Johnson. I've lived with diabetes for over 40 years and have been active in the diabetes, social media space, and industry for a long time. Now, today, we are going to be talking about diabetes distress versus depression. And I've always heard that people with diabetes are at a very highly increased risk of living with depression as well. And I think we need to unravel that a little bit because we've learned some over the past, couple decades or so, right? So with that, maybe I'll throw it over to you, Bill, to kind of get us started pulling on that yarn a bit.
Thanks a lot, Scott. And I'm really glad we get to talk about this. It's actually one of Susan's and my favorite conversations because we've been very concerned about this, that we know if you are a healthcare professional and working in the field with diabetes, or if you're a person living every day with diabetes, you may have heard that you're at elevated risk for running into a serious problem with depression. And that's based on lots and lots of studies that were conducted in the 90s and the early 2000s. And on this very first slide, you can see some of those studies right here. And when looking at those studies all together, what we concluded from this is, wow, you can see that at least a third, maybe half of people with type 1 and type 2 diabetes are struggling with significant depression. And also we know from this same series of studies that what is suggested is that people with diabetes are at double or triple the risk of actually running into a really serious problem with depression compared to people who don't have diabetes. But turns out, more recent data helps us understand there's something kind of wrong with these studies. So as you can see now in the green part of the slide at the bottom, that our newest data tells us something actually very different. In fact, there's more than just the 4 studies presented here. There's been others that I've had the chance to be involved in, some of them, where we know the actual rate of running into a serious problem with diabetes is not 30, 40, 50%, but it might be 3, 4, 5, 6, 8%, something like that. Could be even a little higher. But the data suggests that may not be so different than people who don't have diabetes, which is shockingly different from what we said for years and years and years. So I don't mean to say that depression isn't a big problem, and the combination of depression with diabetes is a really bad mix, right? But the point is, what we've learned is that the actual rates of depression are not nearly as high as we thought, and they're not actually that different from people who don't have diabetes. Now, here's the funny thing, and this really relates to why we're talking about this. Having said all that, I'm going to say something kind of confusing, that if we look at the most common screening questionnaire that we use to try and look for depression, it's called the PHQ-9, what we know is that people with diabetes, type 1 and type 2, tend to score higher than people who don't have diabetes. Well, wait a minute, they score higher. Doesn't that mean they're more depressed? Well, it turns out, at least when you do careful, structured interviews, it turns out that's not true. That these questionnaires to score high on the PHQ-9 is picking up something that's going on with lots of people with diabetes. But in many, many cases, it's not depression. And what it is what we call diabetes distress. Now, we've done research regarding diabetes distress, the emotional side of living with diabetes, how it is that people can feel hopeless and discouraged and fed up and overwhelmed. We've been doing this research for more than 30 years. And we now understand how common elevated levels of diabetes distress are, which you're going to see on this next slide. And what we've learned, looking at all the different ways we can measure it, and there's different scales that look just for people with type 2 diabetes and type 1 diabetes. This is a study, this was a presentation from our colleague, Larry Fisher, who we've done much of this work with, is that what we see is that elevated diabetes stress is in fact way common for both people with type 1 and type 2 diabetes. You can see it way over there on the right in that first row. We estimate it's about 44%. But again, depending on the questionnaire, it actually may be quite higher. By the way, in that second row, you look at people who score high in one particular element of diabetes distress, as many of these scales have different, what we call sources or subscale. And there we see the numbers are even crazier higher. As you can see, the mean over there on the far right is 79.5%, which basically means something that probably is going to be obvious to many of you, which is if you have diabetes, type 1 or type 2, odds are good something's driving you crazy about living with this disease. So why this is important is we think this is why people score high on that PHQ-9. So it turns out that depression rates are kind of low. Diabetes distress rates are in fact really high. And we want to make that distinction. We think it's a very, very important distinction for one critical reason, which is that as bad as depression is, as bad as actually elevated levels of diabetes distress are, the solutions, the treatments are very different. If someone is fed up with their diabetes, giving them an antidepressant medication will accomplish very little. You have to actually talk with folks and help them address the things that they're struggling with and are driving them nuts. So we want to think about that important distinction between depression versus this idea of diabetes distress. And I'm going to turn over to Susan, who's going to really kind of walk through a little bit about how those things look different, how we understand how different they are. Susan, go for it.
Okay. So when I'm thinking about depression, I want to remember that this is a diagnosis. It's a serious medical condition. And when I'm thinking about diabetes distress, it's important to have a conversation with it, but the intervention is very different. So when I'm having a conversation to try and tease this apart with someone that I'm meeting for the first time, I'm really listening for the following things to tease them apart. So that's what this slide reflects. So with depression, there's more of a hopelessness about life in general. Whereas with diabetes distress, you're really talking about the tough thoughts, worries, and concerns about diabetes. And with depression, you're really looking for a more pervasive and persistent problem with mood. In other words, it lasts most of the day and more days than not. With diabetes distress, we know that it's persistent related to the stressors related to diabetes. And with depression, it really interferes with a wide range of functioning across domains such as work, relationships, and health. And the kind of things you listen for are statements like, I'm a failure, everything is hopeless. Whereas with diabetes distress, you may hear like, I'm failing at diabetes, or my efforts at diabetes are hopeless. And both things can interfere with diabetes or not. So sometimes that can be a little tricky too. I think that sometimes we think that if somebody has their numbers at target, that they probably don't have either depression or diabetes distress. And the only way we can know is to ask.
That's a really good point. One of the reasons why this is important and why it can be confusing is because these two problems overlap. I mean, as you can see from the things that are on this slide and what Susan was just talking about, there's some similarities here. That one of the things that depression and diabetes distress share is it's feeling out of control. With depression, it could be feeling out of control about life. With diabetes distress, it's feeling out of control about diabetes, which is why we can often see this overlap when we're talking to folks in terms of if you're a person with diabetes, you may be feeling it sometimes. And it's why our funny questionnaires often don't distinguish between those things very well unless we ask. But the bottom line is, we just want to highlight that what we typically used to call depression all the time, in many, many cases, isn't depression. It really is diabetes distress. The depression and the rates of depression are much lower than we ever thought they were. And what we're starting to understand more and more about diabetes distress is the rates are actually much, much higher than we originally realized. That this is very important, so that don't assume next time, if you're a healthcare provider, you run into someone who's looking down, doesn't want to talk to you, and looking like they might be feeling overwhelmed, you don't have to assume they have some terrible depressive disorder. Even if they, by the way, fill out that PHQ-9, it is perhaps just as likely, if not more so, that they're really feeling like they're failing and feeling hopeless about their diabetes, just like Susan was saying. Again, it's this importance of being able to discriminate those so we can talk about providing people with the right kind of help. So I don't know, Susan, what do you think? Other thoughts about this, or where do we want to go with this?
I'm interested in hearing what Scott has to say before I have a last thought.
Yeah,
Well,
thank you. Good point.
first of all, I'm very relieved to hear that just because I have diabetes, I am not necessarily kind of automatically at this higher increased risk of depression. That I feel like that takes a load off my shoulders. Second, it also feels like it makes a lot of sense that many of us living with diabetes do deal with a lot of diabetes distress because it frankly takes a lot of work to live with diabetes. The third thing that comes to mind with me is the if I'm dealing with diabetes distress and I'm not getting the right help for that, I'm going to feel like a failure there as well, which just feeds into this negative cycle of feeling hopeless and failing at everything I'm trying. So I really appreciate the importance of distinguishing between the two so that the right help can be given.
Yeah. And the right help can get to the right person by helping make this distinction so that when we know that the person is distressed, we don't offer them, for example, an antidepressant. And what we know is that both really respond to intervention, that both depression and diabetes distress are very treatable.
If you're a person with diabetes and you're feeling like you want to deal with some of these issues, one of the things that you might like to know about is the American Diabetes Association's mental health registry. What's nice about that is you can go to that website, which is on the diabetes.org website. And again, look for the mental health registry. You can put it in your zip code and it'll tell you about diabetes knowledgeable mental health professionals in your area. Of course, if you're here in sunny San Diego where Susan and I are, you can come see us as well. But the mental health registry, which is still relatively new, allows anybody anywhere in the US to hopefully find people in your area who may be able to provide you with the kind of help and support you need, who are also knowledgeable about diabetes. And boy, that's didn't used to be true that even was possible or existed. So we're delighted about that. I'm not sure we need to say anything else about this. We could go on 4 days and talk more about how important this is, how living with diabetes distress can make it harder for people to manage diabetes effectively. As Scott mentioned, it's remarkable that not literally 100% of people with diabetes don't struggle with diabetes distress every day, given that you're dealing with this condition that you can't think about all the time, and where it's so easy to feel like you're failing. And it's so driven by numbers and often difficult and problematic relationships with healthcare providers and dealing with the costs of, your medications and technology as well. So it's very understandable that it is so very common. And if you need some help, I hope you'll reach out to get the help that you need rather than having to struggle. So Scott, I hope I'm going to send this back to you. I hope this is going to be useful for everyone, and really glad you and I and Susan are here to be able to talk about this.
Likewise, thank you. I'm so thankful for the work that all of you have done in this space, and my thanks goes out to Dr. Fisher as well, and all of the other wonderful colleagues you all have worked with over the years. I think this is a really important piece of living well with diabetes. And maybe in one of our future episodes, we'll dive a little deeper into what we can do about diabetes distress. That's we don't have time to go into that today, but I think that there's a lot of interest there as well. So big thanks to everyone out there watching, and tune in again for our next episode coming at you very soon. Thank you.